in some ways, I think of physical activity as the new kid on the block in public health in many ways. But the idea that physical activity is important to personal health and therefore the health of populations and community residents goes way back. The early Greek scholars and physicians, presumably based on their own experience. We don't know that they had any, anything that we would call research, available to, base their conclusions on. But apparently, on the basis of their lived experience, they certainly seem to be convinced that physical activity was important to health, and they communicated that through their writings, and so in a sense they were the first physical activity specialists in public health. But fast forwarding a number of centuries, public health became a professional pursuit in many parts of the world in the 1900s. Really, the early 1900s is when public health started to become a focused profession, and physical activity really was not conceptualized as a component of public health. Around that same time, school-based physical education became quite common, and I think the argument that was made by advocates for school physical education in the late 1800s, early 1900s, really was based on health and fitness. So, I sometimes think we could look back to the institutionalization of physical education in schools, particularly in Europe